Your sports figures have made headlines this week for very different but equally serious health battles. Chicago Cubs Hall of Famer Ryne Sandberg passed away at the age of 65 after a fight with metastatic prostate cancer. Meantime, football legend Deion Sanders underwent surgery to remove his bladder due to bladder cancer. Joining us this morning to tell us more about early detection and treatments is Dr. Joseph Wagner, the chair of urology at Hartford Hospital and the director of robotic surgery at Hartford Healthcare. Doctor, thanks for being with us.
Thanks for having me.
Okay, I want to talk right now about the early warning signs or symptoms of prostate and bladder cancer that we all really should be aware of.
I want to stress that most people with urinary symptoms don't have a cancer, but they can be early signs of both prostate and bladder cancer. And these symptoms include urinary frequency, urgency, decreased force of stream. Certainly anyone that has blood in their urine should see the doctor as soon as possible.
How important is early detection when it comes to treating these particular types of cancer?
So early detection is critical really for all cancers, and early stage prostate and bladder cancers are very curable. Unfortunately, once they're metastatic, then our goal moves more away from a cure and more toward controlling the cancer. So patients that get their cancers detected earlier certainly do much better.
What exactly does it mean when you say cancer is metastatic?
That means it's spread to other organs or other parts of your body. And for bladder and prostate cancer, and most cancers, those generally are not curable.
Doctor, let me ask you what screening options are currently available through Hartford Healthcare for both prostate and bladder cancer.
So for prostate cancer, we do a blood test called PSA and generally a digital rectal examination. For bladder cancer, we examine the urine under a microscope looking for red blood cells, small amounts of blood that can be an indication of bladder cancer. Men that are Black and have a family history of prostate cancer are at increased risk for prostate cancer. And then people that are smokers, that's the #1 risk for bladder cancer, are at risk for bladder cancer. And people that have certain chemical exposures or radiation exposures are also at increased risk, although everyone is at risk.
Yeah. Doctor, how often should most people get those tests?
So for prostate cancer, once a year, every 2 years. Bladder cancer, just a urinalysis, which is an examination of your urine at your yearly physical.
Okay, doctor, final question before I let you go. How does Hartford Healthcare approach the treatment of urologic cancers, and what advanced options are available to patients right now?
So we employ a shared decision-making approach where we use accepted guidelines of treatment and then take a patient's medical history and personal history into account to come up with a treatment plan that's right for them. As far as advanced options, we offer everything at Hartford Healthcare that there is to offer for these cancers. You won't find anything different in New York or Boston. And as far as cutting edge things, we have a number of clinical trials that are looking at the latest, greatest innovations.
All right, Dr. Wagner, we appreciate your time. Some very, very important information.